As summer draws closer and temperatures increase, the abundance of rattlesnakes and the hazards they bring increase as well. In California, we face extreme summer heat, the perfect environment for rattlesnake activity. Summer also brings increased human activity outdoors, making it more likely that humans will encounter rattlesnakes. Here recently in Northern California and the Sacramento Valley, their activity has increased. Within the last 2 months, there have been at least 4 reported rattlesnake bites, with 3 of those ending in fatality. This has already surpassed the yearly average of 0 to 1 individuals dying from a rattlesnake bite in just the first 5 months of the year. While their bites are highly deadly, they are treatable and preventable. Named for the noise produced when aggravated, the term rattlesnake encompasses more than one species. Within California, there are 7 different native rattlesnake species. To fully understand how to prevent biting incidents from occurring and, in turn, prevent hospitalizations, we first have to understand their biology. While each rattlesnake species' life cycle is slightly different, the general cycle is as follows. The breeding season starts in March and ends in May, but the babies are not born until the fall months. The female rattlesnakes often nest in old rodent burrows or rock crevices. An interesting fact is that, unlike most other types of reptiles, rattlesnakes are oviviparious, meaning they produce eggs that develop within the maternal body and hatch within or immediately after release from the parent. Thus, by definition, they have live births rather than lay eggs, meaning their children are referred to as a litter of pups. Strange, I know. Each rattlesnake litter consists of between 1 to 25 pups, and each receives maternal care for 1 to 2 weeks before they disperse from the nest. The male pups reach maturity between 3 to 5 years old, and the female pups reach maturity between 5 to 11 years old, thus starting the cycle once more. Rattlesnakes have small, temperature-sensitive pits on each side of their head between the eye and nostril, allowing them to find prey in the dark. They also have a forked tongue to detect the scent of prey. Rattlesnake venom is produced in glands behind the eyes and flows through ducts into hollow fangs. An intriguing part of their physiology is their fangs that fold back against the roof of their mouth and pivot forward to inject venom when ready to strike. According to the California Department of Fish and Wildlife, rattlesnakes mostly eat live prey, though some occasionally feed on dead animals. Rattlesnakes usually hunt in grassy areas near rodent burrows and rocky outcrops. Prey are injected with venom to immobilize them, then swallowed whole by the rattlesnake. Adults mostly hunt rodents such as mice, rats, and ground squirrels, while young rattlesnakes mostly hunt young rodents and lizards. In spring and summer, rattlesnakes are most active at dawn, dusk, and night to avoid overheating. During the fall and winter, they are inactive, and some may go into bermation, or a state of dormancy with periods of activity, for several months in rock crevices, thick vegetation, or rodent burrows, oftentimes gathering with other rattlesnakes within established dens during the cold months. While rattlesnakes may seem to do more harm than good, they act as important predators in each ecosystem they inhabit. Due to the typical rattlesnake diet of small mammals, such as rats, they maintain balance within the ecosystem as a secondary consumer. This balance becomes especially important for public health when taking the spread of diseases into account. As rattlesnakes maintain small rodent populations, they also ensure the reduction in rampant diseases spread by those prey. With naturally managed populations, rattlesnakes help ensure that rodent and small mammal populations do not become too large. If rattlesnakes were completely removed from an ecosystem, there would be an increase of herbivory on native plants, thus reducing plant availability for other animals and increased populations of small rodents, resulting in increased disease spread. Other than the keratin rattle at the end of their tails, the key reason rattlesnakes are so well known and discussed is their highly deadly venom intended to immobilize prey before ingestion. To be specific, they are hemotoxic, meaning their venom attacks the circulatory system, causing internal bleeding and interfering with blood's ability to clot. However, the main reason that people die from these bites is from anaphylactic reactions or failure to seek medical attention for anti-venom administration. General rattlesnake physiology for envenomation include their hollow fangs in the front of their jaws that inject venom into the first few outer layers of skin. Their venom causes increased permeability of membranes, resulting in increased localized spread of the venom. While most rattlesnake species venom has little neurotoxic effects and is not destructive to nerve tissue, there is one species native to California that does, the Mojave rattlesnake. This venom is even more deadly and can lead to cranial nerve dysfunction, weakness, and paralysis. In the end, rattlesnake bites should be treated swiftly and efficiently. However, despite the deadly impact they can have, bites are typically their last resort in a stressful situation. Only biting when threatened, they will first hide and rattle so as to scare predators or humans away. If the threat does not leave, they then strike, bite, and envenomate the threat. However, an estimated 25 to 50% of rattlesnake bites are dry, meaning they choose not to envenomate. Rattlesnakes take an average of 3 weeks to replenish extended venom, resulting in a lack of food for several days to weeks if they bite a threat. Thus, they avoid biting, unless seriously threatened. Public health officials and wildlife managers highlight the importance of avoiding interactions with rattlesnakes, but if it does occur, do not approach further or antagonize it, as these increase your chances of getting bitten. Speaking of venom, I feel it is important to discuss how antivenom works. Antivenom binds to the components of a venom and obstructs them, preventing them from reaching their target. It does not reverse the effects of venom, but prevents further damage being done by filtering out unused toxins. There are 2 kinds of venom that can be administered: monovalent antivenom and polyvalent antivenom. The key difference in deciding which one to administer relies solely on if the identity of the snake species is known. Monovalent antivenoms are formulated to work on the venom of one species, but its effectiveness relies on being absolutely certain of the identity of the snake. If the antivenom is the incorrect snake species, it does nothing to stop the spread of venom. Contrastingly, polyvalent antivenoms are formulated to work on the venoms of multiple snake species, but are more diluted, resulting in more antivenom needed to prevent the spread of venom. One myth that frequents rattlesnake discussions is that baby rattlesnakes are more dangerous than adults due to their inability to control their envenomation. However, the California Department of Fish and Wildlife highlights that this is false. They claim that the larger the rattlesnake, the more venom it will deliver when it strikes. A key way to avoid rattlesnake bites is through being able to identify them. Rattlesnakes have a distinct triangular-shaped head and a rattle at the end of their tail. A rattlesnake may be seen without a rattle if it has broken off, or young rattlesnakes are born with a small rattle or button and may not properly produce a tail buzz until more segments are developed. Rattlesnake scales can be described as appearing matte or dull and have a rough raised texture to help them grip to surfaces. Their patterns are often modeled in earthy tones, which aid in their ability to be well camouflaged in their habitat. Once bitten by a rattlesnake, it is essential that patients promptly seek medical treatment at the nearest emergency department. If bitten by a rattlesnake, patients and family members should not perform any of the following: attempt to kill or capture the offending snake for identification, attempt to transport the snake even if dead, apply a tourniquet proximal to the wound, apply ice to the bite site, attempt to suck the venom out of the bite wound either with a commercial device or by cutting the wound open, or treat the venom with electric shocks to the bite site. Within the United States, roughly 1 in 736 patients, or 0.135%, who suffer a rattlesnake bite dies. Despite these low statistics, it is important to avoid unnecessary interactions with rattlesnakes. Stay informed, stay alert, and stay safe.